In the second section of Chapter 19, we're going to discuss risk factors for impaired skin integrity, discuss the purposes of bathing, describe how hygienic care for the younger and older patient differs. We're going to perform a complete bed bath and back rub, provide oral care for an unconscious patient, prepare to provide personal care for a patient, including nail care, mouth care, perineal care, and shaving, assist the patient with the care of contact lenses, instruct the patient in ways to prevent buildup of cerumen in the ears. Nursing goals for hygiene include the following. The patient's skin integrity will be maintained. The patient's hair is clean and neatly styled each day. The patient's mouth is intact and free from odor. The data collection during the assessment will give you information you need to plan for hygiene care, including a patient's ability to perform the hygiene tasks and any personal preferences or habits. Efforts should be made to help the patient maintain body image. Educational needs and the home environment also must be considered. Use a bath thermometer to check water temperature. When testing bath water without a thermometer, try to dip an elbow into the water, more sensitive than testing with one's hand. Bed rails must be up when away from the side of the bed because the bed is raised and is at working height. Fully draw curtains around the bed to maintain privacy. Draping prevents chills and promotes warmth and comfort. Now we have different types of baths. We have cleansing bath, which is the most common type. It's done in the bed, tub, or shower. We offer patient use of the toilet before bathing. Our patients may need assistive devices such as chairs or stools in the showers or tubs. Then we have therapeutic baths. We use whirlpool baths to clean and stimulate peripheral circulation. We might use whirlpools for wound care, cleansing, debridement, or joint therapy. For sitz baths, we usually use these for OBs, rectal surgeries, and to soothe hemorrhoids. Sponge baths, we compare and contrast with bag baths. Sponge baths and evaporation are useful for fever reduction. Cooling blankets are also used to treat fever. Heating blankets are used to maintain core temperature. We have variations of the bed bath. Sometimes we do a bed bath using a self-contained bag of several pre-moistened disposable cloths. The cloths are moistened with a cleansing agent that does not need rinsing. Cloths may be heated or used directly from the bag. The bag contains many cloths, so a different cloth may be used for different body parts. Cost of this system has a major disadvantage because it is quite expensive. Older adults have decreased sweat and sebaceous gland activity, therefore they don't require a bath every day. Personal preference must be considered. Because of thinner skin and decreased subcutaneous fat, chilling is more likely during the bath. So when we're talking about back massage, we want to position our patient on one side, place a warm lotion in hand, use smooth, gentle strokes to improve blood flow and promote relaxation. Perineal care may cause embarrassment to you and the patient as a result of your close contact with the genital area, but proper draping helps promote comfort for the patient with the procedure. You want to maintain a very matter-of-fact attitude and be objective. Avoid any sexually suggestive conversation or actions. Always remain professional and dignified. That can help reduce the embarrassment. Wear gloves when providing or assisting with mouth care. Use extreme care with dentures. Review the procedure of cleaning of dentures. Mouth care for the unconscious patient, we're going to provide full mouth care at least once every 8 hours. If the patient is mouth breathing, we're going to do it every 4 hours. We're going to remove dry secretions because they can cause halitosis or even obstruct the airflow. We're going to also use moist swabbing of the mouth every 2 hours or as needed to maintain integrity of the oral cavity. When not in the mouth, dentures should be kept in a labeled denture container containing water or normal saline. Do not place dentures on a meal tray because they are often lost when the trays are removed. A written informed consent is necessary to cut a patient's hair. To decrease pain, if a patient has tangled or matted hair, hold the hair between the scalp and the area you are brushing or combing. Braiding the hair helps reduce tangles. Ask permission from the patient before braiding. Alcohol, astringents, or water may be used to loosen hair strands that are tangled or matted. Do not cut the hair to remove tangles. Dry or rinseless shampoo is available for cleaning hair. Either a safety razor or an electric razor may be used if shaving. A safety razor should not be used when a patient has a low platelet count, is receiving an anticoagulant, is undergoing chemotherapy, or is on aspirin therapy. Any razor should be used on only one patient to provide for infection control. You may not shave off a beard or mustache without written informed consent. The toenails of a diabetic patient or one with circulatory disease of the lower extremities should not be cut without a physician's order. Toenails should be cut straight across to prevent them from growing into the skin along the sides. This can cause pain or infection and leads to a condition called ingrown toenails. You may need to observe the color of the nail beds continually to monitor circulation of the extremities. Assess your patient's eyes for drainage, crusting, or redness. If crusting is noted, soak the eyelid with warm, damp washcloth for 2 to 3 minutes to soften the crust and ease its removal. Do not use a paper towel or plastic lenses because it may scratch the lenses. It's important to place the contact lens in the correct compartment of the case, either right or left. Gently wash the external ear canal with warm washcloth. No object, including cotton-tipped applicators, should be inserted into the ear canal. There are 5 types of hearing aids: body-worn, rarely seen today, behind the ear, attached to the eyeglasses, and number 4, in the ear, and number 5, in the ear canal. The purpose of evaluation is to determine whether the expected outcomes set during the planning stage of the nursing process have been met. Feedback from the patient and other personnel should be obtained during evaluation. Which of the following is not one of the basic purposes of bathing? Number 1, cleanses the body. Number 2, promotes comfort. 3, stimulates conversation. Or 4, removes waste products. Answer is number 3. The basic purposes for bathing are to cleanse the body, promote comfort, remove waste products, and promote stimulation of circulation to all areas of the body. Number 4. Which of the following is true regarding mouth care? Number 1. Mouth care creates halitosis and dental caries. Number 2. An unconscious patient should be provided full mouth care at least every 24 hours. Number 3. When assisting a conscious patient with mouth care, you should raise the head of the bed 15 to 30 degrees. Or number 4, dentures should be kept in a labeled denture container with saline or water when not in the patient's mouth. Answer is number 4. Dentures should be properly stored when not in the patient's mouth. Mouth care prevents halitosis and dental caries. Mouth care should be provided at least every 8 hours for the unconscious patient, and you should raise the bed 45 to 90 degrees when performing mouth care. Question number 5. Gary is a nurse working in an acute care facility. His patient is a 20-year-old male who was in an automobile accident. He has blood and glass fragments in his hair, a fractured femur, a mild concussion, and is negative for any other health problems. Which of the following is not an appropriate nursing intervention? Number 1, shampooing the patient's hair and cutting any glass fragments out of his head and hair. 2, washing his feet and trimming his toenails. 3, asking the patient if he wants you to call any family or friends. Or 4, allowing the patient time to rest. Number 1, you may not cut a patient's hair without informed consent unless it is an emergency. You may trim a patient's toenails if there are no diabetes or bleeding disorder present. It is appropriate to see if the patient wants family or friends called and to give the patient time to rest.